Question 1. A client discloses during a counseling session that they are planning to harm their abusive spouse. The counselor's ethical obligation in this situation is primarily guided by which principle? A. Client autonomy and self-determination. B. Confidentiality and privacy. C. Duty to warn and protect. D. Non-maleficence, do no harm. Answer, C. Duty to warn and protect. This question tests your understanding of ethical boundaries and exceptions to confidentiality in counseling, specifically the duty to warn and protect. The keyword planning to harm is a critical indicator that the client poses a serious and imminent danger to an identifiable third party, triggering a counselor's legal and ethical obligation to intervene. This duty mandates breaking confidentiality to notify the intended victim and/or law enforcement to prevent harm. For instance, if a client states they will shoot their ex-partner tomorrow, the counselor must act on the duty to warn. Always remember that client safety and the safety of others always take precedence over strict confidentiality when there's a clear and present danger. Question 2. A counselor is working with a 15-year-old client who is resistant to therapy and frequently gives one-word answers. The counselor attempts to build rapport by discussing the client's interests, such as video games and popular music, before delving into deeper issues. This approach aligns best with which counseling skill? A. Confrontation. B. Interpretation. C. Pacing and leading. D. Advanced empathy. Answer, C. Pacing and leading. This question is about the core counseling skill of pacing and leading, which is essential for building rapport and trust, especially with resistant clients. The keywords resistant to therapy and discussing the client's interests before delving into deeper issues highlight the counselor's strategy. Pacing involves matching the client's communication style and energy to build connection, while leading gently guides them toward exploring new perspectives or deeper topics. For example, a counselor might first talk about a client's hobby, pacing, before transitioning to how skills from that hobby might apply to solving personal problems, leading. Remember, you first meet clients where they are, then subtly guide them toward growth. Question 3. In Erikson's stages of psychosocial development, which stage typically occurs during adolescence, ages 12 to 18, and involves the individual struggling to establish a sense of self? A. Initiative versus guilt. B. Industry versus inferiority. C. Identity versus role confusion. D. Intimacy versus isolation. Answer, C. Identity versus role confusion. This question assesses your knowledge of Erikson's theory of psychosocial development, specifically the stage associated with adolescence. The keywords adolescence and struggling to establish a sense of self directly point to the identity versus role confusion stage. During this crucial period, teenagers explore various roles and beliefs to form a coherent personal identity. If they cannot successfully navigate this stage, they may experience confusion about their place in the world. For instance, a teen experimenting with different friend groups and interests is engaging in this identity-seeking process. Here's a simple way to remember it. Adolescence is all about figuring out who am I. Question 4. A new client presents with symptoms including persistent sadness, loss of interest in formerly pleasurable activities, significant weight changes, and difficulty sleeping for the past 3 weeks. The counselor should first consider which of the following diagnostic categories? A. Bipolar I disorder. B. Generalized anxiety disorder. C. Major depressive disorder. D. Obsessive compulsive disorder. Answer C. Major depressive disorder. This question tests your ability to recognize classic symptoms of a common mood disorder based on the DSM-5-TR criteria. The keywords persistent sadness, loss of interest, weight changes, and difficulty sleeping for the past 3 weeks are hallmark symptoms of major depressive disorder. These symptoms indicate a significant change from previous functioning and a pervasive low mood, distinct from the cycling moods of bipolar disorder or the specific anxieties of other disorders. For example, a client who used to love hiking but now cannot get out of bed for 3 weeks may be experiencing a major depressive episode. When you see a cluster of these specific symptoms lasting for an extended period, always consider major depressive disorder as a primary diagnosis. Question 5. Which of the following best describes the primary purpose of the National Counselor Examination, NCE? A. To determine eligibility for state licensure as a professional counselor. B. To assess a candidate's readiness for doctoral-level counseling programs. C. To certify specialists in specific counseling areas, such as addiction or career counseling. D. To evaluate a candidate's practical skills through observed counseling sessions. Answer A. To determine eligibility for state licensure as a professional counselor. This question focuses on the purpose of a key counseling examination, the National Counselor Examination, NCE. The keyword primary purpose helps you identify the overarching goal of this standardized test. The NCE is designed to assess foundational counseling knowledge and skills, serving as a critical component in the process of becoming a licensed professional counselor in most states. It ensures that candidates meet a minimum standard of competency before entering independent practice. For instance, passing the NCE is often the final hurdle before a supervised counselor can apply for full licensure. Always remember that the NCE is fundamentally about demonstrating readiness for licensure. Question 6. A counselor is leading a grief support group. During one session, a member dominates the conversation, repeatedly sharing their story and preventing others from speaking. How should the counselor best address this situation while maintaining group cohesion? A. Allow the member to continue, as all members should feel heard. B. Directly confront the member and tell them to stop talking. C. Remind the group of the importance of equitable participation and gently redirect the dominant member. D. Ask the other group members to privately address their concerns with the dominant member. Answer C. Remind the group of the importance of equitable participation and gently redirect the dominant member. This question explores effective group counseling leadership skills, particularly managing challenging member behaviors. The keywords dominates the conversation, preventing others from speaking, and maintaining group cohesion highlight the need for a balanced and sensitive intervention. The best approach involves reminding the entire group about norms for equitable participation, then gently and indirectly inviting others to speak, thereby redirecting the dominant member without shaming them. For example, the counselor might say, "It sounds like you have a lot to share, and I want to make sure everyone has a chance to contribute tonight." This strategy helps maintain a supportive environment while addressing the issue. Question 7. A counselor encounters a situation where a client expresses suicidal ideation with a specific plan and means. The counselor assesses a high risk of imminent danger. What is the counselor's immediate ethical and legal priority? A. Schedule more frequent sessions to monitor the client closely. B. Contact the client's emergency contact for support. C. Initiate involuntary hospitalization procedures or seek immediate crisis intervention. D. Explore the underlying causes of the suicidal ideation in more depth. Answer C. Initiate involuntary hospitalization procedures or seek immediate crisis intervention. This question addresses a critical ethical and legal imperative in counseling, responding to imminent suicide risk. The keywords suicidal ideation, specific plan and means, and high risk of imminent danger clearly indicate a life-threatening situation requiring immediate action beyond standard therapy. When a client poses an immediate and serious danger to themselves, the counselor's primary duty is to ensure their safety, often necessitating involuntary hospitalization or involving crisis services. For example, if a client states they plan to overdose that night, calling emergency services is paramount. Always prioritize direct, immediate intervention to ensure client safety in high-risk suicidal situations. Question 8. According to Carl Rogers' person-centered therapy, what is considered the most crucial factor for therapeutic change? A. The counselor's insightful interpretations. B. The use of specific behavioral techniques. C. The presence of the core conditions, congruence, unconditional positive regard, and accurate empathic understanding. D. The client's willingness to complete homework assignments. Answer: C. The presence of the core conditions, congruence, unconditional positive regard, and accurate empathic understanding. This question tests your knowledge of Carl Rogers' person-centered therapy and its fundamental tenets. The keyword most crucial factor points to the essential elements Rogers believed were necessary and sufficient for therapeutic change. These core conditions involve the counselor being genuine, congruence, accepting the client without judgment, unconditional positive regard, and deeply understanding the client's perspective, accurate empathic understanding. For instance, a counselor listening intently and validating a client's feelings without imposing advice demonstrates these conditions. Remember, in person-centered therapy, the quality of the therapeutic relationship, fostered by these core conditions, is what truly facilitates client growth. Question 9. A counselor reviews a client's intake paperwork and notes that the client identifies as a refugee from a war-torn country. To provide culturally competent care, the counselor should prioritize which of the following? A. Immediately refer the client to a psychiatrist for medication management. B. Focus solely on the client's individual symptoms without considering their background. C. Research the client's cultural background, potential trauma experiences, and their worldview. D. Advise the client to assimilate quickly into the dominant culture for better adjustment. Answer: C. Research the client's cultural background, potential trauma experiences, and their worldview. This question assesses your understanding of cultural competence in counseling, particularly when working with diverse populations. The keywords refugee from a war-torn country and culturally competent care indicate the need for a holistic and informed approach. Prioritizing research into the client's cultural background, potential trauma from their experiences, and their worldview allows the counselor to provide sensitive and effective treatment. For example, understanding how different cultures view mental health or coping mechanisms can prevent misinterpretations and build trust. Always strive to understand your clients within their unique cultural and experiential contexts to offer truly supportive care. Question 10. A school counselor is developing a comprehensive guidance program. Which of the following is considered a key component of a developmentally appropriate, data-driven school counseling program, according to best practices? A. Primarily reactive services focused on crisis intervention. B. Services delivered exclusively through individual counseling sessions. C. A balanced program including guidance curriculum, individual planning, responsive services, and system support. D. A program solely focused on college and career readiness for high school students. Answer: C. A balanced program including guidance curriculum, individual planning, responsive services, and system support. This question tests your knowledge of comprehensive school counseling programs and their essential components. The keywords comprehensive guidance program, developmentally appropriate, and data-driven point to a multifaceted approach. A robust school counseling program integrates 4 key components: guidance curriculum, teaching skills, individual planning, helping students set goals, responsive services, addressing immediate needs, and system support, program management and collaboration. For instance, a school counselor might teach conflict resolution in a classroom, guidance curriculum, and also meet individually with a student to plan their high school courses, individual planning. Remember that effective school counseling extends beyond crisis management to proactively support all students' academic, career, and social-emotional development. Question 11. A client participating in a therapeutic group begins to interrupt other members, express hostility, and challenge the leader's authority. According to Tuckman's stages of group development, in which stage is the group most likely operating? A. Forming. B. Storming. C. Norming. D. Performing. Answer B. Storming. This question evaluates your understanding of Tuckman's stages of group development, specifically identifying behaviors characteristic of a particular phase. The keywords interrupt other members, express hostility, and challenge the leader's authority are classic indicators of the storming stage. This stage is marked by conflict, power struggles, and members testing boundaries as they try to establish their roles and influence within the group. For example, a group arguing about how decisions should be made is likely in the storming phase. Always remember that conflict during storming is a normal and often necessary part of a group's evolution towards greater cohesion. Question 12. During the initial session, a client reports feeling constantly overwhelmed by financial debt, which has led to marital conflict and stress at work. The counselor wants to quickly assess the client's immediate and most pressing needs to formulate a first step in treatment. Which type of assessment would be most appropriate? A. Projective personality test. B. Comprehensive IQ test. C. Informal needs assessment or symptom checklist. D. Vocational interest inventory. Answer C. Informal needs assessment or symptom checklist. This question tests your understanding of appropriate assessment tools in the initial phase of counseling, particularly for immediate client needs. The keywords constantly overwhelmed, financial debt, marital conflict, stress at work, and quickly assess immediate and most pressing needs indicate a need for rapid identification of current stressors and symptoms. An informal needs assessment or symptom checklist allows the counselor to efficiently gather information about the client's immediate concerns, prioritize areas for intervention, and understand the scope of their distress. For example, a counselor might use a brief stress inventory to gauge the client's current anxiety levels related to their debt. When starting therapy, focus on quick, targeted assessments to pinpoint the client's most urgent concerns. Question 13. A counselor is working with a client who reports a recent sexual assault. The client is experiencing flashbacks, nightmares, and avoidance of places and people associated with the event. These symptoms have been present for 6 weeks. Based on the DSM-5 TR, which diagnosis is most appropriate to consider? A. Adjustment disorder. B. Acute stress disorder. C. Post-traumatic stress disorder, PTSD. D. Generalized anxiety disorder. Answer C. Post-traumatic stress disorder, PTSD. This question assesses your diagnostic knowledge, specifically differentiating stress-related disorders based on symptom duration. The keywords sexual assault, flashbacks, nightmares, and avoidance, and present for 6 weeks are crucial. While acute stress disorder has similar symptoms, its duration is limited to 1 month following the trauma. Since these symptoms have persisted beyond 4 weeks, 6 weeks in this case, the diagnosis shifts to post-traumatic stress disorder. For instance, if a client experiences these symptoms for 3 weeks, it's acute stress disorder. If it continues for 3 months, it's PTSD. Always pay close attention to the duration of symptoms when differentiating between acute and post-traumatic stress disorders. Question 14. A counselor is preparing to conduct an intake interview with a client from a collectivistic culture who is accompanied by several family members. Ethically, the counselor should first A. Insist on speaking with the client alone to ensure confidentiality. B. Explain the importance of confidentiality to the entire family. C. Ask the client privately how they prefer to include or not include their family in the session. D. Assume the family members are there to participate in the session and include them immediately. Answer: C. Ask the client privately how they prefer to include or not include their family in the session. This question addresses ethical practice in multicultural counseling, specifically regarding client autonomy and cultural sensitivity. The keywords collectivistic culture, accompanied by several family members, and ethically highlight the need for a respectful and client-centered approach. While confidentiality is important, imposing Western individualistic norms could alienate a client from a collectivistic background. The most ethical first step is to privately ascertain the client's preferences regarding family involvement, respecting their cultural values while upholding their right to self-determination. For example, a client might feel more comfortable with family present initially, or they might prefer a private conversation. Always empower the client to define their comfort level regarding family involvement, especially across diverse cultures. Question 15. Which career development theory emphasizes the importance of self-concept and how individuals implement their self-concept through their career choices? A. Trait and factor theory. B. Social cognitive career theory. C. Super's lifespan, life space theory. D. Holland's theory of personality types. Answer: C. Super's lifespan, life space theory. This question tests your knowledge of prominent career development theories, specifically focusing on the role of self-concept. The keywords self-concept and implement their self-concept through their career choices are central to Donald Super's lifespan, life space theory. Super proposed that individuals strive to find careers that allow them to express their self-concept, which evolves over their lifespan. For instance, someone who sees themselves as a helper might pursue a career in nursing or counseling. Remember, Super's theory views career choice as a lifelong process of expressing and implementing one's self-concept in the world of work. Question 16. A client presents with symptoms including recurrent, unexpected panic attacks, followed by a persistent concern about having more attacks and significant changes in behavior related to avoiding situations that might trigger an attack. These symptoms have been occurring for the past 2 months. Which diagnosis is most likely? A. Agoraphobia. B. Social anxiety disorder. C. Panic disorder. D. Specific phobia. Answer: C. Panic disorder. This question tests your ability to differentiate anxiety disorders based on specific diagnostic criteria. The keywords recurrent, unexpected panic attacks, persistent concern about having more attacks, and significant changes in behavior related to avoidance are the hallmark features of panic disorder. While agoraphobia often co-occurs, panic disorder focuses on the unexpected attacks and the worry about them. For example, a client might experience sudden, intense fear multiple times a week and then start avoiding crowded places because they fear having another attack there. Remember that the core of panic disorder is the surprise attacks themselves and the anxiety about future attacks, which then often leads to avoidance behaviors. Question 17. A counselor receives a subpoena for a client's records. The client has not provided consent for the release of information. What is the counselor's most appropriate initial response? A. Immediately release the records as requested by the subpoena. B. Inform the client about the subpoena and seek their informed consent to release the records. C. Ignore the subpoena unless a court order accompanies it. D. Destroy the client's records to protect their privacy. Answer: B. Inform the client about the subpoena and seek their informed consent to release the records. This question tests your understanding of legal and ethical responses to subpoenas concerning client records. The keyword subpoena indicates a legal demand, but the crucial point is that the client has not provided consent. Counselors have an ethical and often legal obligation to protect client confidentiality. The most appropriate initial step is to contact the client, inform them of the subpoena, and discuss the implications of releasing their records, seeking their informed consent. For example, if a client refuses, the counselor would then typically assert privilege or seek legal counsel to determine the next steps, possibly challenging the subpoena. Always prioritize informing your client and obtaining their consent before releasing confidential information, even when faced with a legal demand. Question 18. A counselor is working with a child who frequently acts out in school and at home. The counselor decides to implement a token economy system where the child earns points for desired behaviors, which can then be exchanged for rewards. This intervention is most consistent with which theoretical orientation? A. Psychoanalytic therapy. B. Behavioral therapy. C. Adlerian therapy. D. Existential therapy. Answer: B. Behavioral therapy. This question assesses your knowledge of counseling theories and their associated interventions, specifically focusing on behavioral approaches. The keywords token economy system, earns points for desired behaviors, and exchanged for rewards are all classic components of behavioral therapy. Behavioral interventions are based on principles of learning, such as operant conditioning, to increase desirable behaviors and decrease undesirable ones through systematic reinforcement. For instance, a child might earn a token for completing homework, which can later be traded for extra screen time. Remember that behavioral therapy focuses on observable actions and uses structured reinforcement to change behavior. Question 19. A research study aims to investigate the effectiveness of a new counseling intervention by comparing outcomes between a group receiving the intervention and a control group receiving no intervention. Participants are randomly assigned to either group. This research design is best described as A. Correlational study. B. Qualitative study. C. Experimental study. D. Case study. Answer: C. Experimental study. This question tests your understanding of different research methodologies, specifically identifying the characteristics of an experimental design. The keywords effectiveness of a new counseling intervention, comparing outcomes between a group receiving the intervention and a control group, and randomly assigned are definitive markers of an experimental study. Experimental designs involve manipulating an independent variable, the intervention, and measuring its effect on a dependent variable, outcomes, while controlling for other factors through random assignment. For example, assigning some clients to receive CBT and others to a waitlist control to compare depression scores is an experimental design. Always remember that random assignment and manipulation of a variable are key to establishing cause and effect in an experiment. Question 20. A counselor working with an adolescent client notices that the client consistently reports negative self-talk, such as "I'm not good enough" or "I always mess things up," leading to feelings of sadness and withdrawal. The counselor decides to help the client identify and challenge these thoughts. This approach is most characteristic of A. Solution-focused brief therapy, SFBT. B. Rational emotive behavior therapy, REBT. C. Gestalt therapy. D. Psychodynamic therapy. Answer: B. Rational emotive behavior therapy, REBT. This question tests your knowledge of specific cognitive therapeutic approaches, particularly rational emotive behavior therapy, REBT. The keywords negative self-talk, identify and challenge these thoughts, and the focus on how thoughts lead to feelings like sadness and withdrawal are central to REBT. REBT, developed by Albert Ellis, posits that irrational beliefs, negative self-talk, lead to emotional distress, and therapy involves disputing these beliefs to adopt more rational ones. For example, the counselor would help the client see that "I always mess things up" is an overgeneralization and explore evidence against it. Remember, REBT actively helps clients recognize and challenge their irrational beliefs to improve their emotional well-being. Question 21. When a counselor interprets a client's nonverbal cues, such as crossed arms and avoiding eye contact, as resistance or discomfort, the counselor is utilizing which type of communication skill? A. Paraphrasing. B. Summarizing. C. Attending behavior. D. Reflection of feeling. Answer: C. Attending behavior. This question assesses your understanding of fundamental counseling microskills, specifically focusing on how counselors demonstrate engagement. The keywords interprets a client's nonverbal cues, crossed arms and avoiding eye contact, and resistance or discomfort point directly to attending behavior. Attending behavior encompasses nonverbal and minimal verbal behaviors counselors use to show they are present, listening, and observing the client's communication, including body language, eye contact, and vocal quality. For instance, noticing a client shift in their seat or speak more softly are examples of attending to nonverbal cues. Remember, effective attending is crucial for building rapport and truly understanding the client's unspoken messages. Question 22. A counselor is preparing to terminate therapy with a client who has made significant progress toward their goals. Which of the following is the most important consideration during the termination phase? A. Referring the client to a different counselor to prevent dependency. B. Emphasizing the client's successes and preparing them for independent coping. C. Introducing new, more challenging therapeutic goals for the client. D. Limiting discussion of future challenges to maintain a positive outlook. Answer: B. Emphasizing the client's successes and preparing them for independent coping. This question tests your understanding of the essential tasks and ethical considerations during the termination phase of counseling. The keywords terminate therapy, significant progress, and most important consideration highlight the need to consolidate gains and empower the client for future independence. During termination, the counselor should reinforce the client's achievements, review coping strategies, and discuss potential future challenges while instilling confidence in their ability to manage them independently. For example, a counselor might create a termination ritual by reviewing a list of the client's accomplishments and new skills. Always ensure that termination is a planned, empowering process that prepares the client for continued growth outside of therapy. Question 23. A counselor believes that a client's current distress stems from unresolved issues from their childhood, particularly their relationship with their parents, and uses techniques like free association and dream analysis to explore these unconscious conflicts. This approach is characteristic of which theoretical orientation? A. Behaviorism. B. Psychodynamic therapy. C. Cognitive behavioral therapy, CBT. D. Humanistic therapy. Answer, B. Psychodynamic therapy. This question assesses your knowledge of major counseling theories, specifically the tenets of psychodynamic approaches. The keywords unresolved issues from their childhood, relationship with their parents, unconscious conflicts, free association, and dream analysis are all central concepts and techniques of psychodynamic therapy. This approach, rooted in Freudian principles, emphasizes how past experiences and unconscious processes influence present behavior and emotional states. For example, a client's recurring dream of being lost might be explored for its connection to childhood feelings of abandonment. Remember, psychodynamic therapy delves into the past to uncover hidden influences on current psychological functioning. Question 24. A client reports experiencing significant work-related stress, leading to difficulty concentrating and irritability. The counselor suggests practicing mindfulness exercises, such as focused breathing and body scans, to help the client manage their stress response. This intervention is most aligned with principles from A. Existential therapy. B. Gestalt therapy. C. Mindfulness-based stress reduction, MBSR. D. Narrative therapy. Answer, C. Mindfulness-based stress reduction, MBSR. This question tests your familiarity with contemporary therapeutic approaches, specifically those incorporating mindfulness. The keywords work-related stress, difficulty concentrating and irritability, and mindfulness exercises, such as focused breathing and body scans, clearly indicate an intervention rooted in mindfulness-based stress reduction, MBSR. MBSR teaches clients to cultivate present-moment awareness and non-judgmental observation of thoughts and feelings to reduce stress and improve well-being. For example, a client might use a guided meditation to calm their mind when feeling overwhelmed at work. Remember that MBSR utilizes structured mindfulness practices to help individuals cope with stress and enhance their overall mental health. Question 25. A counselor is facilitating a psychoeducational group on assertiveness training. The primary goal of a psychoeducational group is typically to A. Resolve deep-seated intrapsychic conflicts. B. Provide members with information and skills to prevent or cope with life stressors. C. Promote catharsis and emotional release. D. Foster profound personality restructuring. Answer, B. Provide members with information and skills to prevent or cope with life stressors. This question tests your understanding of different types of therapeutic groups and their primary objectives. The keywords psychoeducational group and assertiveness training are strong clues to its purpose. The main goal of psychoeducational groups is to educate members and equip them with specific knowledge, skills, or strategies to prevent problems, cope with challenges, or improve their overall functioning. For instance, an assertiveness training group aims to teach communication techniques, not to delve into members' childhood traumas. Remember, psychoeducational groups are about teaching and skill building for specific life issues.